Hey everyone, it's Tim Rea here in studio in San Francisco at the Digital Health Summer Summit. A really cool panel called Sometimes You're the Windshield, Sometimes You're the Bug. Lessons learned from broken business. And what it was basically bringing some really interesting entrepreneurs to the table to tell their stories. So we have Rick Lee, who's the executive chairman of M3 Information and a former founder and CEO of Healthrageous. And he's stealing my stage with a brighter shirt than my glasses. So how are you doing?
I'm doing just fine, Tim.
So we had an interesting conversation. I'm an entrepreneur, so I always love hearing stories, war stories, and what's going on. So let's drill right down into the money. You know, people do I go with friends and family, angel? Is VC worth it? Is that the holy grail? What's your opinion? What have you learned?
I'm a big believer in VC funding. I find that they're very good at directing you to how to make decisions. They provide excellent counsel. They're terrific supporters. When you're considering bringing on somebody, they'll exhaustively interview them and make sure you've picked the right people. They feel the same way about how to find the right market and go after the right market. So I'm a big fan of VC-backed funding.
So you're getting a professional bench to help you out, but is there any drawbacks?
The drawback is that the VCs are inherently ADHD, and they know.
Because I remember hearing like, do they take you off the track?
They are knowledgeable, mile wide and inch deep. So
that's a good one. All right, I like this. I like where this is going. For the folks out there who are doing a startup in this digital health space, first of all, we got to hear about your background in the space so we understand where you're coming from.
I've been on 4 founding teams. I've been at the cutting edge of the managed mental health industry, of the disease management industry, of the cancer management industry, and most recently the behavioral wellness industry. So I'm really proud of the creativity that I bring to the positions that I take on and my opportunity to see new markets where previously there weren't.
Yeah, so we're going through a radical change right now. What markets are real, what aren't, and where would you place your bets on startups?
I love the consumer market for healthcare. I think that we're all living with our bodies. We're all taking on more financial responsibilities for that health burden that we each essentially put into our own selves by making bad choices or unhealthy choices. So I think that there's a tremendous upside for treating consumers as consumers of healthcare and not as patients of medicine.
Preventative and owning your responsibility.
Yeah.
Hickory Ridge Capital, you have an interesting title. What is that?
I'm the chief Imagineer. So
is that like a Disney title, or what is that?
It is a Disney title, and it just reinforces the message that I'm all about going after the consumer, not the patient. Getting an activated, engaged consumer to own their own body and be involved in their own health.
And what is Hickory Ridge Capital?
Hickory Ridge Capital is an early stage venture fund. We've raised $30 million and we're deploying it in early stage, either sub A or Series A investing.
Cool. So pretty early down the pipeline. And do you have any interesting deals you're working on right now?
I have some very interesting deals I'm working on. One that I saw earlier this week that brings animation into healthcare. So we want people to be engaged, and this is a firm that's working with Dr. Oz, and they're providing all the animations for Dr. Oz. And the value of this is that you've got 6 animators that are trained in like Pixar studios, and so they get it. It's not the healthcare education where you give people a pamphlet and say, read it. There are no pictures and there are a lot of big words. This is very different. This is working in a whole new medium, which is engaging for consumers and fun to be participating in.
So relationships are everything in this business. What's the best way to reach you and to reach your fund?
I'm on LinkedIn. I can be reached at Rick at Hickory Ridge Capital, and I can be reached at rick@frederickclee.com.
Okay, last question. The getup, I love it. What's the inspiration?
These are the brand colors of Healthrageous, so I haven't gotten over the loss of my company, and it's now in the hands of Humana. But lime green and black were very trendy when we picked them in 2010, and now they're mainstream.
All right. Hey, well, thanks so much. Here at Digital Health Live, San Francisco. Thanks so much for your time.
Thanks, Tim.